The governor, speaking at the launch, termed the Emergency Medical Services, also known as EdoEMS, as an innovative medical service designed to improve the health services in the state. He stated that the EdoEMS was introduced in order to sustain the emergency service system already present in the state. He expressed his elation over the introduction of the EdoEMS in the state, adding that it was as a result of the diligent steps taken through the last 6 years of his administration to prioritize the healthcare of its citizens.
And very well thought out. Emergency response is just not a group, fleet of ambulances. Emergency response is about a system that calls up what you can imagine health reserves across a network and puts them on alert such that if there is an emergency, somebody who has been trained, who has the knowledge, will be 10 minutes away from you with the services to provide support and care and be able to move you safely to the nearest point for care delivery.
Speaking to the news crew, Kingsley Wagbale, Commissioner for Public Safety and Security, Folake Owoduni, and other key stakeholders of the EdoEMS project expressed confidence and optimism with the introduction of the EdoEMS project in the state, highlighting the ways the emergency response system would better the lives of citizens and improve the healthcare sector in the state.
For us, this is a major milestone because when you talk about emergency response architecture, you're looking at medical, you're looking at fire, you're looking at crime and other stuff. So what we've achieved today is to fast track our medical emergency response, right? So such that when you call the 739 now, you call the 112, you sure know that there's not just somebody not just going to pick your call. They will pick your call. There are ambulances to respond.
EdoEMS is what I would describe as a labor of love, a collaboration between Emergency Response Africa, the Edo State government, and funded by the Fund for Innovation in Development. EdoEMS is really about reducing the number of preventable deaths that happen in Edo State. We all know the stories. We all know people that have lost their lives, not because they had to, but simply because there was no timely response. This is a solution to that. We will be training community-based first responders who will be distributed across their communities to provide first aid whenever there is an emergency. We've also upgraded several ambulances within Benin City to be able to receive those patients and transport them to the hospitals. We look forward to a robust end-to-end system, something that Edo State citizens can count on.
Currently, the training is ongoing for the community-based first responder that will be at the various levels of the community. In case there is emergency, they definitely will call the dispatcher that will activate us as paramedics in the ambulance, who will definitely respond. As paramedics, our role is to ensure that the sick, the injured are promptly taken to hospital in case of any medical emergencies.
Now, if you also think about accident victims, you see what this EMS would do. What we would ask that people embrace it, own it, make it theirs. Do not make fictitious call so that because that will overwhelm the first responders. All right? This is yours. Like I said to some other group yesterday, this is not a solution for big men. It's a solution for us, the ordinary people. Let us make it ours. When you see the ambulance cars, help to keep it going. Clear the way for them because you're going to save somebody's life.
High Point was the official flag off of the EdoEMS project with the introduction of brand new ambulance buses.
And launch these ambulances that will serve the pilot program of the Emergency Response Service of Edo State Government.
Governor Gov Obaseki said his administration is poised to delivering quality healthcare to Edo people. Oluwatoyin Oyedola reporting for BTV News.